Reproductive Rights says Texas law allows doctors to terminate ectopic pregnancies, yet those two women say they were denied urgent care. And their attorneys say as long as these bans are in place, doctors will be terrified to perform an abortion of any kind. Yet people on the other side of this issue say this federal complaint is just a political jab to reverse the abortion laws in our state.
Kylie Thurman's situation, she was turned away from the same hospitals again and again. In Kelsey Norris Dela Cruz's situation, she was denied treatment for her ectopic pregnancy entirely, even though the hospital staff acknowledged that the pregnancy might rupture.
That's Molly Duane. She's the senior staff attorney at the Center for Reproductive Rights. The organization is representing Kylie Thurman and Kelsey Norris Dela Cruz. According to the newly filed federal complaints, both Thurman and Norris Dela Cruz faced life-threatening pregnancies. Now they are asking the federal government to step in after hospitals in the state allegedly refused them emergency care. The Center for Reproductive Rights says both women had ectopic pregnancies. It is when the fertilized egg implants in a location other than the inside of the uterus. If they rupture, it can cause severe internal bleeding and ultimately death. Spectrum News reached out to both hospitals named in the federal complaint: Ascension, Seton, Williamson Hospital, and Texas Health Arlington Memorial Hospital. The only hospital that replied was Ascension, Seton, Williamson Hospital. In a statement, it said, quote, "While we cannot speak to specifics of this case, Ascension is committed to providing high-quality care to all who seek our services."
When you're talking about a ban that is so severe, I mean, the most severe penalties imaginable, life in prison and loss of your medical license, what we're seeing nationwide in states with abortion bans is that physicians are terrified.
The federal complaints seek to ensure that Texas hospitals provide emergency abortion care for pregnant people in such dire situations, as is required by federal law. However, Amy O'Donnell with Texas Alliance for Life says Texas law already allows doctors to terminate during an ectopic pregnancy. She says if the physicians did not provide proper care, it needs to be addressed.
The rules and guidelines for doctors from that governing agency are clear. If doctors did not perform the standard of care, I would think that a better route for these two women would be to pursue why that was that oversight on behalf of the doctors that needs to be addressed so that other women's lives are not affected and harmed, because it's not an issue with our laws.
This complaint was submitted to the federal government for an investigation. If there is a finding that either of the hospitals violated federal law, then the federal government will work with that hospital to come into compliance.
Center for Reproductive Rights is definitely playing games and politicking to try to get laws passed to, again, promote their agenda of abortion on demand up to birth.
In Austin, Barbara Fox, Spectrum News.
Thank you for watching our YouTube channel. Let Spectrum News be your resource for balanced, in-depth political coverage, and click the subscribe button right here. You can also download our app or watch us on TV to learn more about the candidates, where they stand on the issues, and more. We'll see you then.